So welcome to Parenting with a Brain Tumor. I just like to always start out our session just by, again, a final acknowledgement, because this is our last one, of the three programs that joined together to support the presentation of this programming. So there's the UCSF Gordon Murray Caregiver Program, there's the Sherry Sobrato Brisson Brain Cancer Survivorship Program, and the Milton Marks Family Camp that all came together to offer this programming. My name is Margaretta Page. I am the nurse coordinator for the Gordon Murray Caregiver Program. I'm joined today by Dr. Abby Marks, who's a clinical psychologist, Lacey Fetting, a licensed clinical social worker here at the UCSF Cancer Center, and Amy Arms, who's a marriage and family therapist from the CARA Grief Support Organization in Palo Alto. And then I always like to acknowledge Mary and Naomi, who've been really instrumental in supporting us in the background for this program. So thank you to everybody. Thank you to those programs, and welcome to everybody who's here today. So before we get going, I just want to run through the day just so you kind of know what to expect. After our meditation, we will do like we've been doing, go right into breakouts for a little check-in. Then we'll hear from Abby with some content about parenting and living as a family with a brain tumor. And we'll have a second breakout, kind of digest some of that information. And then we'll all gather back for what I'm calling our expert panel. So we have these wonderful experts who will be able to answer your questions today. So I want to encourage you to take advantage of having Abby and Lacey and Amy here with us so they can answer any questions that you might have. And also remembering that each time one of you asks a question, we all learn from each other. So I do want to, I hope that you'll take advantage of our time. So I'm going to switch to the next slide and just get started. I want to take a moment just to invite you all to settle in to our afternoon. And let's just fully arrive at our session. I want to give you a minute just to let go of your morning and really settle in here with us for the next hour and a half, okay? So as we get going, I just invite you to, if you'd like to close your eyes or softly gaze at the floor, and maybe for the next minute, we'll just practice taking some deep breaths. Okay, I'm going to invite you all back. And we are going to move you right into your breakout sessions. I want to just hopefully, and a little, just allow you just a chance to reintroduce yourselves, maybe share how things are going for you as a parent over the last couple weeks, and just anything that's come up.
Okay, So one of the things we wanted to talk about today is just how to help your whole family, how to have good times as a family, and when to, what to look for in your kids to see if they need help. So I think if you were going to take one message away, or one of the messages that I would love you to take away, I think we all would, from today is just, this is a really, really hard thing to be dealing with, in addition to all the other things you need to deal with as a parent. And perfection is not the goal. You can help your kids through this. You can help each other as much as possible, but being able to maintain things as they were before or even better is not necessarily the goal. So I think the first part of this is, what kinds of things can you do to help yourself that might be able to help your kids? And by yourself, I mean, you as the patient, you as the caregiver. And not to forget that all of the things your kids need, sometimes we feel like there isn't enough time. I mean, generally there isn't enough time if you're working, or even if you're not working and you've got kids at home. And then if you add everything that you need to be taken care of as a brain tumor patient or as a caregiver, that can get overwhelming. And I think parents often get really, really overextended. And then it can feel like you just have to extend yourself farther to be able to meet more of the needs that your kids have. And it's important to remember that sometimes making time for yourself, taking a breather, getting help for yourself and your family, taking things off of your plate can actually be just as helpful to your kids as direct things that you can do for them by taking time with them or helping get things set up for them. So if we think about, I often have the image of, parenting and parenting through one parent's illness as keeping a lot of balls in the air. And sometimes those are too many balls in the air to even be able to catch. And sometimes we can feel like we can get really hard on ourselves for not doing everything. So one thing I find really helps is to sit down either by yourself or with your partner and to be able to really think about what is the most important. If you can't get to everything, what things do you want to make sure to get to? For a lot of families, that's the kids and time with the kids. And I found, at least for me, that it's really helpful when let's say you have a list that's a mile long, you are doing something like cooking with your child or doing an art project or being there facilitating your partner doing something with your child, just to remind yourself, if that's one of your top priorities, that's enough. You don't need to be able to be thinking all the time about what you're not doing. The other thing that I like to recommend to people and have found helpful myself is, if you make a list of everything that you really think are the most important things you need to be doing, and then you just make a point of getting to the top few things on the list, because as you probably already know, there's no way everything is going to be able to be done. So figuring out what things can be put off, what things can be delegated to other people, and what things can just be jettisoned from the bottom with no guilt. I know that's easier said than done. The other thing I think we've been trying to talk about for all three of these workshops is really how to practice self-compassion. And that is really hard. And I think it has to do with this idea of really accepting that there's no perfect way of doing all of this, and that things can be less than ideal and it can still be fine, and what you're doing can still be enough. It's really hard. One of the things I think we talked about with kids last week is that none of them chose for this to be happening to their parent. And so that can really make it hard for them to feel like they don't have a choice in other things. And I think that's true with us as adults as well. It's hard to really feel like we have to kind of give up control about what we're able to get to or not to get to, or how our life is going to turn out. And I think one of the most important things to remember and to keep as a practice is that it's fine if, it may not be fine that things are not turning out the way you wanted them to, but it's fine that you necessarily aren't able to change things. if you're not able to, or if that you're not able to do everything you want to for your kids or your spouse, because that's just kind of the way the nature of this awful disease is. Okay, so one of the parts of self-compassion, when we're more compassionate with ourselves, we can think about what are our limitations and how can we make the most of any kind of our networks or any resources that might be available for us to actually get some help and be able to make our lives easier. When our lives are easier and there's less on our plates, it's better for our kids as well. So this is probably, since you're all past the initial diagnosis, this is probably already something that you've done. Organizing your support system, getting friends to help you organize your support system. This can be anything from, letting a friend who really wants to help organize a meal train when it's necessary. Or if meals are not helpful, organizing people to have play dates with your kids, or even just have a friend figure out who's really out there to help you with things that you might need. And even maybe making a list of things that our friends are able to help you with that might not be as obvious as, say, bringing meals over. So one of the times we do this is diagnosis, but this isn't only important at diagnosis, although that's when people in your support system may be the most kind of motivated and activated to help you. But, maintaining help through a long illness often means getting help, with still being able to reach out, or finding out what people are able to do for you in the long term, whether that's family or friends or neighbors or parents at your kids' school. Another thing to really keep in mind is to kind of try to keep in touch with when you're maxed out with the things that you're already doing to help. And I think this is especially true when, brain tumors, as you all know, it's a disease that changes rapidly. Things can be really, really hard one day and then really, really good the next day. And it's hard to even know what those days are going to be. And also as other things come up, disease progression or or surgeries that happen, and then a recovery period after that, it's hard to sometimes remember that there may be times that you need to ask for more help with something. For example, for getting somebody to come in the house, maybe, a couple of days a week for a few hours, doing cleaning, doing cooking, if you're a caregiver, staying with the patient while you pick up your kids from school. There may be various times where you need to kind of, it's very easy for us as caregivers and as patients to want to try to stretch ourselves at all times. And I think it's important to remember that there are times where we may get maxed out, and it is better if there's a way of taking things off of our plates, if that's possible. So there's many strategies for doing this kind of thing. One thing is dividing the load between yourself and anybody that's willing to help you. Sometimes people, I think it can be hard when people come up to you and say, let me know if you need any help, because that's often something that it's so nonspecific that it's hard then to go and reach out to those people afterwards. But sometimes it helps to make a list of people who offer that at one time, and then you yourself, or even delegate a friend to say, actually, this is one thing I could use help with. Can you sit with me while I pay my tax, while I organize my taxes this year? Or how would you feel about helping me make a spreadsheet for summer camps for the kids? Or would it be okay to take my kids on a play date this weekend so we can get some alone time as a couple? Okay, so now I want to turn to red flags of things, how do we know how our kids are doing? When are things kind of just a normal way that kids often process one of their parents being ill? And when they may be struggling a little bit more, what things we can do? And then when it's, what are really red flags that mean that we should pay more attention and get some outside help? So one is just, and I should say about all of these things, you know your kid, and it may just be a gut sense for you that they really need help right now. And that gut sense is enough to reach out. But just to spell it out, anytime your kid really behavior really changes, they start acting out more, they're more tearful, there's more tantrums, their grades slip at school, for example. Things, they seem to have changed since last month or last week. That's something to pay attention to. I mean, some of these are going to be obvious, but new anxieties, new phobias, they don't want to go outside. They have a hard time falling asleep. They worry and worry and worry about tests at school. I mean, those things can be displaced anxiety about the illness, nightmares that they keep having, even if they don't seem to be related. These are all ways that children express their distress. Significant changes in appetite or sleep, or I should say, or even in going to the bathroom, things like that. Those are ways that sometimes the body tells us, and I'm sure you're aware, that something's up. You're sleeping all the time, you're tired all the time, or you can't get to sleep, or you wake up early. Or you wake up in the middle of the night and come in your parents' room. Some of that can be normal and normative for kids where there's disruption. But if you feel like the changes are significant, that's something to pay attention to. The same with appetite. If your child is not eating at meals and only having snacks, or just not hungry, that is also something to really pay attention to. Those tend to be big red flags. If kids are more isolated, they're not going out with friends, they're in the room all the time, they don't want to come out, they don't want to spend time with family, although, of course, with teenagers, you may see this in a normative way, but especially if they're isolating themselves from friends. As I mentioned before, having difficulty at school, grades suddenly drop, or, a lot of conflicts in their friendships. And really, losing interest in activities that used to bring them joy. These are the kinds of things that we expect to see. When we think about, for example, depression in children, it doesn't necessarily look the way that it does with adults. This last thing, if they're losing interest in things, if they don't seem happy, if everything seems sad to them, or they don't seem like they're getting a lot of joy, that is very similar. But other things like anxiety about anxiety about things not being perfect in any way, or themselves not measuring up, for example. Appetite and sleep are big things that we look for when we look for signs that kids are really in trouble. And of course, expressing a desire to hurt themselves or somebody else. So what can you do if you see these red flags, or anything that might be a red flag? Well, there's a number of things you can do on your own if you don't want to reach out for help, or before you reach out for help. So one of the things, as I mentioned, and this gets back to self-compassion and helping yourself, is if you see your child is struggling, see what you can take off your plate. As we've mentioned before, it's hard when you're a child in a family where one parent is ill, because the parent who's ill is going to be occupied with their own healing, and in some ways, are sleeping more and a little bit less available. And the parent who's well is also going to be less available, because you're taking care of a lot of stuff that you didn't have to before. So the more that you can remove things from your own plate, I know it sounds a lot easier than it really is, the more you can be available to your child or children. And one way to do that is by finding out how you can get more help at home, babysitter, even if it's a friend, if you have the means to do it, hiring a college kid who can be a playmate for your kid, even if they're a little old for a babysitter, getting help house cleaning, things like that. Reaching out to family or friends, maybe they can spend time with your kids, or they can help you so you can. Another thing that can help is one-on-one special time, and that's basically just making sure that there's somebody to watch your other kids, and taking that one kid out to do whatever they want to do, or just spending an hour turning off your phone, turning off any distraction, and saying, I'm going to spend this 1 hour with you. We can do anything you want within reason. Then for more serious red flags, like if there's some really extreme changes in behavior, extreme changes in sleep or appetite or phobias or anxiety or wanting to hurt themselves, one of the things you can do is reach out to your child's pediatrician. They usually will have a way of getting your child some help. They will also be able to talk to your child and kind of assess them, and perhaps hook them up with a therapist or hook you up with a parenting coach or a therapist that you can talk to yourself, a child therapist you can talk to about helping your child. Another way of getting help for your kid is to, if they're younger, talk to their teacher. If they have one teacher, often their teacher will also have observed things going on with them and will care about them. And a lot of schools have school counselors they might be able to see at school, or will have ideas for referrals that might fit your family's budget to help outside of school. Those are two, talking to your child's pediatrician and talking to the school counselor, are ways of getting referrals to child and family therapists. And there's also seeking out a child or family therapist on your own. Sometimes if you have friends who have kids who've seen a therapist, that's a good way to go. Have them ask their therapist for a recommendation, or a parenting coach or a parenting counselor. There's also online resources that you can seek out. The PAC program at Massachusetts General has online resources about parenting at a challenging time. I think, Margaretta, we're going to send those out, or links to that out to you guys. The American Cancer Society has many online resources, cancer care. And for grief work, there's Cara in Palo Alto, and Amy Arms can tell us more about that in a little bit. Or the Dookie Center in Portland. So, if you're not seeing red flags, but you still want to help your kid, let's think a little bit, or let's talk a little bit about what helps kids get through this kind of time and be resilient. So one of the things that I've found to be really, really helpful for families, and it's a bit counterintuitive, is finding ways for kids to help. It's counterintuitive because sometimes you think there's so much going on in their lives, I just want to give them a break. But actually helping out, whether it's helping out around the house, having regular chores, finding specific ways they can help the patient feel better, is a really, really important thing for kids to be doing in this time. Why? Let's see if I have a note. Nope, that's a note about something else. So why is it important for kids? It's important for a few reasons. The first reason is it can help them feel more part of the family that's all mobilizing to do something. When somebody gets ill, it can feel so out of control. And sometimes the only way to actually have control over anything is to be able to control, or to be able to help somebody feel better, or help kind of maintain or manage things that can make the family feel better. So for example, that might be everybody doing dishes after dinner as a family activity. Or it might be a chore somebody takes on, one of the kids takes on and does every day and gets a lot of praise for. I think helping kids notice the impact of whatever they're doing is really important, in the form of, thank you so much for unloading the dishwasher. This made it so much easier for us to then clean up, and it made my life easier. Or whether it's, let's say the brain tumor patient is going through radiation, and your child is able to make you a delicious smoothie that you love and doesn't have any flavors or any smells that are irritating to you. And then the child getting to see you really, really loving that thing that they make for you, or they make a drawing for you and you show them how much you love it. And that can make a huge difference. It can really, really let kids feel like they have impact. They can do things and they're not helpless. Alone time with each child, as I mentioned, can be really, really helpful. And whenever you can, giving kids choices and control. And that can be, this is a tried and true parenting technique. So you may already be using this, whether it's, do you want, Life cereal or Cheerios? Or, let's think about what we might want to do this weekend. What kinds of things do you think you might want to do? Control over what they wear, choices that they actually can make, that are appropriate for them to make about themselves, and give them a feeling of being able to do things, have some impact, not be helpless. Another thing that's helpful to kids is fostering their relationship with other people, extended family, their grandparents, mentors, friends, to give them more supports directly during this time. And as we mentioned, the first week, being able to really name what's going on, be open to discussions, fostering transparency and communication in your family can also help kids feel like they're part of this. They're part of it. They get to know, they get to ask questions. Nothing is taboo. Another thing that can really help kids, as well as help you as parents, is making sure that schools and after-school programs that they're in are really in the loop with what's going on. It can feel like something else that's on your plate, but a lot of times schools and after-school programs have resources and ways of helping that you wouldn't even think. And also, it lets schools kind of keep a special eye out for your kids, and help them through the day, even if they don't need, for accommodations or anything like that. It can just kind of create a more and foster a more caring environment for your kids. This is the question, how to protect normal childhood, that I think goes through all of our minds, which is, this meteor has been dropped on your family, and how can you make sure that that it doesn't derail the life that you've already tried to bring to your kids. Sometimes you can protect a normal childhood and sometimes you can't. I think, as always, keeping up routines, making sure they get play dates with friends, things like that are really important. But also, I think, and making things as predictable as possible, even when they're not. So if there's anything that you can do to make something more predictable, or to let them know in advance and give them a heads up when things are going to be different, that's going to be helpful for them. So the next thing we want to talk to you about is thinking about legacy. And legacy is just the things that you as parents get to pass down to pass down to your kids or to the world. What are you going to be leaving? What can you accomplish in your life? This is really important for many brain tumor patients and many people and many caregivers as well, to think about, if their life is going to be shorter, if your life is going to be shorter, it becomes really, really clear that some things are more important than others, and what things are the biggest priorities for you, and what kind of a mark can you make. And one way to think about that when we think about family is, what kind of impact are you going to have, or what kind of legacy are you going to have for your kids? And in a way, one way this isn't the only way, but legacy, the things that you leave for your kids, the mark you make on them, we know from parenting research, is more about the relationship than anything else. It's not necessarily, I think sometimes some parents feel like, and this is people with brain tumors, people without brain tumors, people with cancer, people without cancer, feel like, I need to kind of mold my kids in a certain way, and that's going to be my legacy, so that they have the same morals or ethics that I have, for example, which is a wonderful and lovely idea. But oftentimes what kids carry on from us as they leave and grow older, and we grow older, is the imprint of the relationship. I mean, this is true for kids who even don't have, memories, for example, of young childhood. Even if they're not going to remember things we said or things we did together when they were babies, they still have the imprint always of the way we carried them, the way they were held, the way they were spoken to, the feeling that they had when you walked into a room. And the more that you can spend time building your relationship and your good relationship with your kids, the more that is making solid things that they can carry on and carry in and with them into the future. So one of the things that we had some examples of some things you guys can do together as families, for example, to have good moments together. And I'm actually going to stop sharing for a minute and ask Amy Arms to share this idea, because it's an activity she sometimes does with families that I think is really lovely.
Yeah. Hi, everyone. So this is kind of around the ritual in some ways too, which is helpful for kiddos and families. But one idea that we have, this idea of a gratitude jar or a memory jar, thankful jar, is that as a family, you can just get a mason jar. The kids can decorate it. And whenever something strikes you, you notice that your child does something that you really appreciate, or something happens that the family does together that you want to point out, or maybe your partner does, you can add anything into the family jar and occasionally reach in together and read these special moments that you guys share together. You could choose, this is the ritual part, you could choose that maybe every Sunday at dinner you read one, or maybe you just do it randomly when you guys need to connect a little bit. Additionally, you could have a family jar, and each child or the child in your family could have a jar as well that you add to, just that is special for that child to have. So, and I'm sure you can come up with all sorts of things that you could add in, even maybe, well, we had a really great night tonight and Dad loved that chocolate chip ice cream. Just something, little things that you can remember about each other to put in there. So, yeah.
Yeah, I think anytime you can create little rituals, even in the midst of a life which is changing, where things aren't necessarily predictable, nighttime rituals, any other rituals you can create can be very satisfying and meaningful to kids. I'm going to share my screen again. Here's some other ideas about making time for family fun, for rituals you can do together. One thing is just, it may be that a lot of the things you used to do together as a family, you cannot do now, whether that's because of mobility issues or stamina. But there's often activities that you can plan that are just as fun for the family and meaningful, geared to the brain tumor patient's strengths. That can be anything from, watching a fun movie together to making meals together, to playing cards, depending on what it is. The other thing is I put here is seize the day, which is, it often, as you know, it's often true that, you might have no energy one day and then wake up the next day and feel really great. And I think that the kind of idea that when you are feeling good, it's okay to actually indulge yourselves as a family in a way that you might not usually. It's okay to seize that day and say, okay, we're going to go to an amusement park today, or we're all going to go out and have ice cream sundaes, or whatever kind of treat you can that's not planned ahead just because you're feeling good that day. And then there's all sorts of new family activities. I mean, obviously, these kinds of things are a challenge, not just because of brain tumors, but because of COVID now as well. It might be that things that you guys used to do are harder to do, but spending some time really thinking about not just what our limitations are as a family, but what our strengths are as a family, and even involving kids and brainstorming new things that you guys might be able to do together that might be fun, that you could set up in the backyard or in the kitchen, can be a really lovely thing to do. And as I mentioned before, anytime kids help out, whether it's thinking of a new activity or whether it's setting up some kind of elaborate, hide and seek activity in the backyard or something like that, acknowledging and rewarding them for helping out and making the day fun is very appropriate. Okay, I'm going to stop sharing again. And I think what we're going to do, Margaretta, you're muted.
I am. So what we thought we would do in the small group is just maybe take a moment to think about anything that you heard just now, maybe that resonated with you. And I think we wanted to give you a chance as the experts of your own families, maybe to share with each other what's worked well for you so far. Have you uncovered any strategies that have been good? Or maybe you're still searching, and maybe there's things you want to just ask more questions about. So I thought that's how we would maybe use the next 10 minutes or so, and then we'll go to the real Q&A session with our licensed professionals after that. So
I would especially love to hear about family activities that you found that yourselves doing after diagnosis in the pandemic, and other things you felt have been really successful in connecting with your kids. Awesome. That's lovely. That's lovely. I'm curious about, how we talked a lot about, or I mentioned about different ways of getting help with things and taking off your things off your plates. And I'm curious how you all have managed that. How hard is that to do? Have people been available to help you out? Or because I know that can be really challenging. I mean, I think that's hard for everyone, actually. I mean, I'd love to hear what the rest of you like. Has that been hard for you? And what have you found helpful in being able to ask? Or
Sometimes I hear that people might want to help and you're like, I don't know what I can ask you to help with, or you feel that guilt comes up, like, I don't want to ask you to help, but they're trying to help. Sometimes sitting down with each other and writing out lists of things that would be helpful, and then making that available to friends and family so that they can choose something that might be helpful for you. And then you don't feel as burdened with, giving them something they may not want to be helping with, or having that thought process about it.
That's a great idea.
I mean, just like people inside your family, friends and extended family can also feel really helpless. I mean, they can't do anything about the diagnosis, and they're not doctors. They can't cure the cancer, although some people do fundraisers for that and stuff. But I think a lot of people end up feeling really connected to you, and like they can do something by just doing something that lifts something off your plate or making you feel better in some way. And it is really hard being on the inside of that to see that there's also a benefit to the person who's helping you. Margaretta? Yeah.
Well, I have one that someone who's not here sent in, but asked if I would ask it to you, and then they'll listen on the recording.
Okay.
And they actually said that they've been, as a couple, the brain tumor's been in their family a long time. So when they were diagnosed, their children were very young. And so it's pretty much all that their children have ever known is the tumor. And so, and the person with the tumor, the parent with the tumor, doesn't have a lot of vulnerabilities or obvious symptoms. So they're wondering how and when do you bring up the conversation when it's all these kids have ever known. So how do you do that? Is there a strategy for that? That's the question.
What specific conversation do you think that they're talking about? What do they want their kids to know as a result of this conversation?
I think it's how to be, well, everything says you have to talk to your kids, right? And so so naturally we had someone actually who was even here with us who had a 1.5 and a 3-week-old, right? So think about that family going forward. So I think it's that, Lacey. How do you bring up the topic when it's all they've ever known?
I mean, I have some ideas, and I don't know if Lacey or Amy, if you do too. I mean, in a way, it's kind of like, I mean, there are a lot of reasons to want to talk to your kids. First of all, it's kind of like anything that's an ongoing thing that will feel like a huge secret or like a huge like bomb going off in someone's life if they find it out suddenly and it feels like you've been keeping it from them. Like the way we could talk to kids about adoption, for example, or anything that's going, that they need to know about that will change their lives. But it's hard, right? Because usually when we have these kinds of conversations with kids, it's because something's happened, a diagnosis, a disease progression, something is about to happen that you want to prepare them for. And I guess I would say, I have a couple ideas, but I'm curious about what you all, because you guys are all veterans of these kinds of conversations, about what you all think. One idea is just to try to throw it in wherever possible in a really nonchalant way, because of the brain tumor, or because of oh yeah, remember when you were in the hospital with it, whatever, just to try to, I mean, obviously you want to throw it in and then explain it, but as a kind of fact of life, in the same way we talk about, like I said, like about adoption or kids that were donor conceived, for example, just so that it's just kind of a part of their lives and a part of the regular fabric. And one of those things that's talked about and referred to without having to be, kind of a big deal. And then maybe at some point saying, having a conversation about how there's some things about our family that are like a lot of other families, and there's some things about our family that are different. And, maybe there's other things about the family that are different too, or other, communities that they're in, or they're a baseball playing family or whatever it is. And that you can say, one of the things that I think you kind of know, but we haven't really talked about is mama's brain tumor or daddy's brain tumor. Have you ever been curious about that? And then just seeing, and they might be like, nope. And, or one kid might be like, no, but one kid might be yes. And, so you could try that. You could also try like bringing books home sometimes. Oh, we've got a book. Do you want to read more about, daddy's brain tumor? Or here's some pictures of when I went in the hospital, or look at family pictures together. And then there's maybe one with a shaved head and the scar. And, oh, what's that from? And so I guess, I think, like we think of all of these conversations as being kind of gradual and not necessarily all at one. It's not just like you have one and then it's over. I would think about it in the same way and keep, I'd say like every 6 months or so, make some kind of a bid to see if it's something kids are interested enough in to want to know more about.
Yeah. I was thinking too, Abby, that like if you're probably having checkups whether it be every 6 months or once a year or something, that's a good time to, hey, I'm going to the hospital, just a doctor's appointment to get checked up. You have any questions? The other thought is a visual timeline of the family, of their lives. So,
Yes.
Bobby was born on this day and Sally was born on this day and mom's diagnosis happened on this day and her surgery was here, but intermix it with all sorts of different things. So you can have a picture of mom with the shaved head and all of these other things that are happening. So I want to say it normalizes, but it makes it a part of the family conversation. Right. And it's easy to come back to have that. And for kids, having that visual piece of it, that they can also have that control and add things to, could be really helpful for them.
Yeah. Yeah. And they can draw all sorts of things on it. It doesn't have to be anything about the tumor. Mm-hmm. And that can also help if you're talking, like if the tumor, because for some families, the tumor happens before kids were born. Mm-hmm. So it can be on a timeline that includes like your parents meeting, or things in their childhood.
Which that's part of that legacy too, right? And overall of right. Things.
I'd be really curious, Amy and Lacey, to what you feel about this, but I guess I kind of feel like, kids and teenagers, especially, they make very good use of defenses, and even defenses that we would consider to be extreme in adults, like, this is not happening. If you have something major happening and an adult that's like, I'm just going to pretend it's not, that can feel really extreme. But for a kid or a teenager, it isn't. That can be really healthy, that he's just trying to maintain his life as normal and it's working right now. And you're not seeing, a lot of kids can try that but still the worry kind of busts out in different ways and you see it in terms of their behavior or their anxieties. But if it's working for him and he doesn't want to talk to a therapist, I think that's fine.
Yeah.
And you can reassess. Yeah. Go ahead, Lacey. Sorry.
Yeah. I mean, I think the one thing is that you've presented that to him. You've put that out there. That's a possibility. And so it's really helpful. And I think kids dose themselves with what reality they can accept with. And it's like staring at the sun. Sometimes you really just can't. You just move away from staring at the sun. You're aware it's there, but you're not going to stare right at it. Mm-hmm. As tolerated, kids dose themselves on when they someone and just being available, and I think the idea that we've had that I've heard talk about is part of the family rituals that they have or things they share together is some sense of a check-in or a meeting. Just as here has felt and has said to us, this is really helpful. This is really helpful. This time and this space that we have for you all to share how you've experienced your illness and how you're parenting through it. Making that available to your kids, whether they on it that day, they might not give you the satisfaction of saying today's a great day. 2 days later, they might come around and say, and the check-in starts. It might not be when you say the check-in or the family meeting will happen. It might be more spontaneous, but it's making yourself available to them. Does that make sense?
Yeah. Sometimes with teenagers, I think, they want to think about it as the least amount as possible and release the least amount possible of information. And sometimes I think it depends on your kid, obviously, but sometimes you can get them to say a number, like, how are you doing? How are you doing with daddy? I don't know what you call, with dads or daddies or papa's, illness. How are you feeling about it? And you normally won't say, but maybe he'd give you a number from 0 to 10. So it's like, how are you doing this month with it? This month I'm a 3. It's felt like 10 is the best, or I don't know, 10 is the most distress and 0 is no distress. This month I'm a 3. Now I'm a 5. And then you can say, well, let's see if it inches up to 7. Maybe you want to talk to somebody.
I had a patient whose child would text them, but not talk to them, because it was maybe a little bit too vulnerable. So
yeah.
I think kids are like cats. They come to us when they're ready, and we better be having that open laugh. Mm-hmm. So, and it's whatever way they communicate too.
Yeah, I was thinking too of sometimes, this is obviously very much on, adults' minds, right? And it probably is on your kids' mind too, but kids do cycle through stuff, right? They are still kids and they play, and even teens are wanting to have that normal stuff. So that may not be the biggest thing that's on their mind in that moment too. So I think also, having those open conversations with them and checking in with them and seeing where they're at. I remember there was a couple that I met with years ago that they were so worried about what their child was thinking about the brain tumor and what was going on with them. And they knew something was wrong. And when we finally sat down together and asked kiddo what was going on, he was worried about something that had nothing to do with the brain tumor. But they were so caught up in everything they were dealing with that they didn't even think about the fact that there might be something else going on for kiddo. So I think, yes, having that option of like, this person is here, if you want to go talk to somebody, we can have them do that, but just checking in with them and seeing, what other things are going on for you besides this diagnosis that our family has. I don't know if that makes sense, but yeah.
Thank you.
Yeah. And I think that's important, as Abby said earlier too, your son, right?
Yeah.
You know how he's doing and what's going on for him quite a bit, I think. So.
Well, I think that's two really important questions that I would separate those out. One is the very difficult question, the very difficult task of finding a child therapist that has openings and is seeing people in person. That's just really hard right now. I know I'm not even seeing people in person, and it is, your 9-year-old's right. Like 9-year-olds kind of need to be seen in person. I do know of a few people. So if you want, I can pass those names on to Margaretta, but I know they often don't have openings. And also the therapist that he's seeing now, if you say like, or she, your younger?
Yeah.
You say like, I think she really needs to see someone in person. That therapist may be able to help you find somebody also. And then the other question though is really important, I think, which is how can we know, like, how can we know how to have conversations with our kids about their anxieties and know it's going to be okay if we open something up? That's what you're asking, right? Like,
Right.
And I actually think just in a way, making it an experiment. And this is the thing about anxiety, it's contagious, right? So your child might have anxiety about things and be worried that if she tells you that you're going to get anxious and that the anxiety is just going to be too much to handle and no one can handle it, and it's going to blow everything up and everything apart. And so I think those conversations can feel really risky. I do think active listening, and by active listening, just like, I think what you mean is just really being attuned to your child and listening to her and making sure like she knows you get what she's talking about. It is usually enough. And then with anxiety, I think the other thing to keep in mind is just to know that it's a feeling that's not going to destroy you and is not going to destroy her. And the idea that you can sit with it, she can sit with it, and no matter how anxious she's going to be at a certain moment, that anxiety may have a crest and then we'll finish, right? Maybe thinking about talking to somebody or learning some breathing techniques or other techniques that she can use and you can use to help calm her down will empower you to feel like even if she gets really anxious at that time, you can help her get regulated again. And just some really, really simple ones right now. One is just getting some bubbles and working on her getting calm enough that she can blow the bubble, because with blowing it's a breath control kind of thing, right? You blow too hard, it's going to break. And if you go too soft, it won't work. Or even breathing exercises like 4, 7, 8 is one where you breathe in on 4, you hold it for 7, and you breathe out for 8. Just having her do that, or even kind of a 4-3-2-1 where it's like, notice 4 things that are blue, notice 3 things that are green, and have her say those to you. 3 things that seem soft, 2 things, anything, just to get her like out of her head. And just that actually, if you're thinking about that stuff, it's hard to get anxious, believe it or not. Just
There's a
little things you
senses
can-
one with
What?
that too. There's a senses one. 5 things you see, 4 things you hear, 3 things you smell. You can kind of come down with that. I also was going to share, there's a website called Sitting Like a Frog, and it's actually a book, but they have recorded mindfulness, and it's very focused for children. And so it's
That's
a really
awesome.
wonderful thing. So sitting like a
Stopping
frog.
whatever you're doing in order to focus and observe is the beginning of every mindfulness exercise. It helps you find out what you're thinking, feeling, and
Didn't mean to
doing.
interrupt you, Abby. I just
No,
recently
that's
learned
great.
about
I
the
mean,
senses one, and I loved it. So
I love that too. I mean, I think if you empower if you have like a few tricks up your sleeve to help her calm down, and you can feel empowered to just sit through it with her, then I think it can be very freeing for your child to be able to tell you all about her worst fears and have you be able to communicate to her that's going to be okay.
Yeah.
And
and
just
that it's okay to feel those feelings too, right? Like I think you being able to acknowledge it and talk to her about it is probably going to go a long way. She probably is aware in some ways that you're nervous when she, gets a little bit anxious. And so if you're able to check in with her and even say to her, sometimes it's hard for me too. And so maybe we can do this together, can be helpful. And that's modeling too for her, a really positive way of handling it. In my experience, most of the time when we're nervous about talking to a child about something, they already are thinking about it. They already know about it. We're more worried about talking to them about it than they maybe already, are thinking about it. It might not even be as big a deal as we're making it in some ways. Because we have those bigger brains, we think a little bit more. Or maybe just more busy brains. That's probably a better way to put it.
Thanks, Amy, Abby, and Lacey. We're at time. And I, as much as I think we've all enjoyed coming here every week, it is time to bring our series to a close. So we'll close up today in a similar way that we have been every week for the last 3 weeks. I want now just to have you take a minute and just invite you to think back on the last 3 sessions and our time together. And then today I'm going to call on your names, and I'd like you to think about a word that you would like to give to everyone else here as you leave today. Okay. So I'll call on you and then just go ahead. Abby.
compassion.
Hope.
Hope. Amy.
Kindness.
Kindness. Lacey.
Relief.
And relief. Thank you. Grateful.
Yeah.
Mary Destry.
Nurturing and nourishment.
Nurturing and nourishment. Empowerment. And confidence. So thank you, everyone, for attending. And please, we'll be following up with an email with some of the resources that we've mentioned. If you have questions or concerns, know that we're here. And I want you to feel free to reach out to me here at UCSF, and I'll try to answer your questions or connect you up with Abby, Amy, or Lacey as needed. Just know that we're here for you and that we want to help you as needs arise.
Thank you. Bye.